Consent and medical decision making is the topic, and then at the end I have some vignettes to share. Now, consent essentially involves getting permission from a patient during any type of procedure or medical intervention. Now, in emergency situations, we don't really do that, right? We just kind of presume consent and proceed because there's no time. But in non-emergency situations, that's really what we're talking about in this video. Now you have to split it up into children and adults. In children, of course, the consent is obtained from the parent or the legal guardian. Now, in adults, that's where the discussion is really a little bit more complicated, and that's what I wanted to focus on. So we're talking about informed consent and medical decision making in adults. So there's a 5-step process that you go through. The first and foremost is you basically just simply ask the patient. And if the patient is competent, then you go by what the patient says. The next step is something that you go toward if the patient is unable to communicate. Maybe the patient is intubated, or maybe the patient is unable to speak because he's unconscious or she's unconscious. Well, what do you do at that point? Then what you do is you look at what the patient has written previously in any type of medical document. For example, the patient might have a living will, or the patient might have some sort of healthcare documents or an advance directive in which he or she clearly outlines what they would want done in certain situations. For example, they say, don't intubate me or don't resuscitate me. So if it's written, then you go by what's written. Now, what if the patient doesn't fit the first two categories? Patient is unable to communicate, and the patient doesn't have anything written, there's no documents. Then what you do is you ask the person who has been appointed as the healthcare proxy. And there's different terms. Some times it's referred to as power of attorney, healthcare power of attorney. Sometimes it's referred to as a surrogate. Whatever the term is, basically this is a person that has been previously appointed by the patient to make healthcare decisions on their behalf, on behalf of the patient, if the patient is unable to do so. So patient is intubated, patient is unable to speak, patient does not have anything written, then you go to number 3. Who's that healthcare proxy, surrogate, power of attorney? Now what happens if there's no proxy or power of attorney? Then you go to the 4th, which is next of kin. Next of kin most commonly means a relative. Most common types of relatives are spouses, an adult child of the patient, a sibling, brother or sister, and sometimes a close friend if there's absolutely no other family around. And finally, even if that isn't present, there's no next of kin, then every hospital, at least in North America, has a hospital ethics committee. And also, you can always go to the courts, which is unfortunately very time-consuming and really a last resort. But this 5-step process, the proper way of going about it. And as always, please, please, please document well. And if you do this, you will be legally protected. Even if the outcome is not what you had hoped or what anybody had hoped, if you follow these steps, you will be fine in terms of a legal standpoint. Now I wanted to talk a little bit about informed consent, which really has to do with the first part, where you're speaking to the patient. If you are speaking to the patient and you are trying to get consent to do some medical procedure or intervention, the patient must have clinical competency and capacity. Patient must have the ability to understand you and make decisions. The physician must communicate clearly and make sure that all risks and benefits are discussed. And very important, I think I already mentioned this, but the patient must be competent. If they are to make informed decisions, they must be able to do so. And if you are unsure about the competency of a patient, then you can have a psychiatrist evaluate the patient and give a clearance that yes, this patient is indeed competent to make decisions. Patient absolutely has the right to refuse treatment. And always respect the patient's autonomy. And what I mean by that is that individuals always have the right to make their own decisions, uncoerced, informed decisions. So let's take a crack at a few vignettes, see if we can put these rules into play. All right. First one. 67-year-old woman has suffered a massive subarachnoid hemorrhage. Patient was well until 3 days prior when she had a sudden loss of consciousness. After emergent transport to the local hospital where her trachea was intubated and CT scan disclosed a large grade 4 subarachnoid bleed, she was transferred to the ICU. Over the past 72 hours, her condition is unchanged. She is non-responsive to deep pain stimulus. There is no doll's eye or gag reflex. Corneal blink is absent. There is discord between the family about whether to withdraw care. The husband desires care to be withdrawn, whereas the children want to continue maximal supportive care. You explain that the most important determining factor in helping to direct future care is. Okay, well, let's just go through the 5 steps. First thing, what did the patient say? What is the patient saying? Well, in this case, the patient cannot say because she's non-responsive. She's in the ICU and she's intubated. So can't do that. Next thing, what does the patient have written? Anything written in an advance directive or a previous living will? And that is one of the choices. That is choice E. Patients previously expressed wishes regarding life support, if known. So that would be the answer. Now let's go through these other answer choices, see where they fit in. Number 3, if you remember, was the healthcare power of attorney or proxy, or power of attorney, POA. Is that one of the choices? Yes, choice C. Husband is proxy, but that is after the patient's written wishes. So that would be, I put a 3 beside that. That would be what you would do next if you didn't have anything written by the patient. If you keep going here, A is involving the courts. So if you remember, 4 was actually the next of kin. If there's no power of attorney or proxy, and 5 was actually the hospital ethics committee or the courts. So the courts are actually 5, and hospital ethics committee is also 5. B, the decision of the medical and nursing team. Medical and nursing teams are probably going to be involved in the 5th one, the hospital ethics committee, so I'd put that as a 5 as well. Next question. 30-year-old gravid at 2 para 1 at 41 weeks, 5 days gestation, has been in active labor for about 30 hours. Epidural was successful, placed at 5 centimeters, cervical dilation. Although the cervix has been dilated 10 centimeters for the past 8 hours, fetus has descended the pelvis minimally. An OB ultrasound obtained for estimation of fetal weight at 38 weeks gestation shows a 4,000 gram fetus. There are also obvious signs of non-reassuring fetal heart rate. Patient's sister had a cesarean hysterectomy because of massive hemorrhage, and the patient adamantly refuses a cesarean delivery, despite your efforts to assure her that this is the treatment of choice. Best course of action is, well, right off the bat, number one, what the patient says. The patient has said no, and you have to respect her wishes. It unfortunately may not be the best possible outcome, but you have to respect her wishes, document it, and you will be legally protected. So that is choice B. Document your recommendation and follow her request for no intervention. If you go through these other choices, choice C would be probably the next in line if she was unable to make decisions. Obtain her husband's permission, because that's the next of kin. Try to convince her family. Again, family is also next of kin, so that would be probably next in line. And then courts and hospital ethics committee are the last choice in the flow of decision making. And finally, 87-year-old man is admitted to the hospital under your care for gangrenous involvement of his toes of his right foot. An arteriogram shows that revascularization is not feasible. After extensive evaluation, the surgeon recommends amputation below the knee. Patient is alert and oriented to person, place, and situation. You and the surgeon explain the situation to the patient, and despite his dementia, you both believe that he adequately understands the risks and benefits of the surgery. Another physician and nurse also witnessed the consent procedure and believe that he has full comprehension of the risks and benefits of the surgical procedure. However, the patient's son, who is designated proxy and the patient's power of attorney, healthcare documents, adamantly opposes any surgical intervention. Despite detailed discussions and several family meetings, the son remains adamant about refraining from any surgical intervention. The most appropriate action is. Well, this is what ethics is all about. Very difficult, right? But the law is the law, and you have to follow the rules. And the rules state that first, you go by what the patient says. And it's interesting how, in this question, first you and the surgeon, right there, explain it. And then because you probably weren't sure, you had another physician and nurse witness it. And that was all done to legally protect yourself. You've been convinced that the patient understands everything and is competent, and he says yes, he consents to the procedure, so you have to follow his wishes. Yes, the number 3 thing is the healthcare proxy, and in this case the son is the proxy and he says no, but the fact that the patient says yes overrides that legally. So you have to go with what the patient says, and that is choice E, proceed with the amputation. Most of these choices are just an outright no. They don't have any role in the legal process. And then the hospital attorney involving the courts, that's the very last step. But getting him to see a psychiatrist or asking the son to find another doctor or discharging him is completely unethical. The first one is not even needed because we already have determined that he is competent. Both the physicians and the nurse have witnessed the patient and assessed his competency and agreed that he is able to make his own consent to this procedure.